Many people experience stomach discomfort from time to time, but what exactly does it mean to have a sensitive stomach? In this video, we'll explore the common causes behind sensitive stomachs, how to recognize when symptoms might be more serious, and what you can do to manage your digestive health. Whether you've had mild bloating or more persistent issues, understanding the root causes can help you make better choices for your well-being. Let's start by defining what a sensitive stomach is and why it's so common. A sensitive stomach refers to a digestive system that reacts strongly to certain foods, stress, or environmental factors. People with sensitive stomachs may notice symptoms like bloating, gas, nausea, or abdominal pain after eating specific meals or during stressful times. While it's not a medical diagnosis, it's a term used to describe a pattern of discomfort that can interfere with daily life. Understanding what triggers your symptoms is the first step toward finding relief and improving your quality of life. Sensitive stomach symptoms can vary from person to person, but some of the most common include bloating, cramping, nausea, and changes in bowel habits such as diarrhea or constipation. Some people may also experience heartburn or a feeling of fullness even after eating small amounts. These symptoms can be mild and occasional, or they can become more frequent and bothersome, affecting your daily activities and overall comfort. One of the leading causes of a sensitive stomach is food sensitivities. Certain foods, such as dairy, gluten, spicy dishes, or fatty meals, can trigger digestive discomfort in some individuals. Your body may have trouble breaking down specific ingredients, leading to symptoms like gas, bloating, or pain. Keeping a food diary can help you identify which foods are problematic and allow you to make better dietary choices. Emotional factors like stress and anxiety can have a significant impact on your digestive system. The gut and brain are closely connected, so when you're feeling anxious or under pressure, your stomach may react with symptoms such as nausea, cramps, or changes in bowel habits. Learning stress management techniques, such as deep breathing or mindfulness, can help reduce these symptoms and improve your overall digestive health. Irritable bowel syndrome, or IBS, is a common condition that can cause a sensitive stomach. IBS is characterized by recurring abdominal pain, bloating, and changes in bowel habits. While the exact cause isn't fully understood, factors like stress, certain foods, and hormonal changes can all play a role. If your symptoms are persistent and interfere with your life, it's important to talk to a healthcare provider about the possibility of IBS. Sometimes, a sensitive stomach can be triggered by food poisoning or infections caused by bacteria, viruses, or parasites. These can lead to sudden and severe symptoms like vomiting, diarrhea, and stomach cramps. While most cases resolve on their own, it's important to stay hydrated and seek medical attention if symptoms are severe or persistent, especially if you notice blood in your stool or signs of dehydration. Certain medications, including antibiotics, pain relievers, and even some supplements, can irritate the stomach lining and cause digestive symptoms. If you've recently started a new medication and noticed stomach discomfort, talk to your doctor about possible alternatives or ways to minimize side effects. Never stop taking prescribed medication without consulting your healthcare provider. Eating too much or too quickly can overwhelm your digestive system, leading to symptoms like bloating, indigestion, and discomfort. Chewing food thoroughly, eating smaller meals, and avoiding late-night snacks can help your stomach process food more efficiently. Paying attention to your eating habits is a simple but effective way to reduce stomach sensitivity. Lactose intolerance is a common cause of sensitive stomach, especially in adults. People with this condition lack the enzyme needed to digest lactose, the sugar found in milk and dairy products. This can result in bloating, gas, and diarrhea after consuming dairy. Switching to lactose-free products or plant-based alternatives can help manage symptoms. Some people have trouble digesting gluten, a protein found in wheat, barley, and rye. Gluten sensitivity can cause stomach pain, bloating, and fatigue, while celiac disease is a more serious autoimmune condition that damages the small intestine. If you suspect gluten is a problem, consult your doctor for proper testing before making dietary changes. Fatty and spicy foods are common triggers for sensitive stomachs. High-fat meals can slow digestion, while spicy ingredients may irritate the stomach lining. If you notice discomfort after eating these foods, try limiting your intake and choosing milder, lower-fat options to see if symptoms improve. Some artificial sweeteners, such as sorbitol and xylitol, can cause digestive upset in sensitive individuals. These sweeteners are often found in sugar-free gum, candies, and diet foods. If you experience bloating or diarrhea after consuming these products, consider reducing your intake or switching to natural alternatives. Caffeine and alcohol are known to irritate the digestive tract in some people. Caffeine can speed up digestion and cause diarrhea, while alcohol may inflame the stomach lining and lead to discomfort. Moderation is key, And if you notice symptoms after consuming these beverages, try cutting back to see if your stomach feels better. Sometimes, a sensitive stomach is a sign of an underlying medical condition, such as ulcers, gastritis, gallstones, or inflammatory bowel disease. These conditions often require medical evaluation and treatment. If your symptoms are severe, persistent, or accompanied by other warning signs, it's important to seek professional advice. While most cases of sensitive stomach are harmless, there are times when symptoms may indicate a more serious problem. Warning signs include severe or persistent pain, unexplained weight loss, blood in stool or vomit, ongoing vomiting, or difficulty swallowing. If you experience any of these symptoms, it's crucial to consult a healthcare provider promptly. Some symptoms require immediate medical attention. These include sudden, severe abdominal pain, signs of dehydration such as dizziness or very dark urine, high fever, or confusion. If you or someone you know experiences these symptoms, seek emergency care right away to rule out serious conditions like appendicitis or bowel obstruction. Tracking your symptoms, foods, and activities in a diary can help you and your doctor identify patterns and triggers. Note when symptoms occur, what you ate, and any stressful events. This information is valuable for making lifestyle changes and guiding medical evaluation if needed. Staying hydrated is essential, especially if you're experiencing vomiting or diarrhea. Dehydration can worsen symptoms and lead to complications. Drink water regularly, and consider oral rehydration solutions if you're losing fluids quickly. Avoid caffeinated or alcoholic beverages as they can contribute to dehydration. Fiber plays a key role in digestive health. Soluble fiber, found in oats, fruits, and beans, can help regulate bowel movements and ease symptoms of sensitive stomach. However, too much fiber or a sudden increase can cause bloating or gas. Gradually increase your fiber intake and drink plenty of water to support digestion. Probiotics are beneficial bacteria that support gut health. They can be found in yogurt, kefir, and fermented foods, or taken as supplements. Some studies suggest that probiotics may help reduce symptoms of sensitive stomach, especially after antibiotics or infections. Talk to your doctor before starting any new supplement. Mindful eating involves paying attention to your food, eating slowly, and savoring each bite. This practice can help you recognize fullness cues, reduce overeating, and minimize digestive discomfort. Avoid distractions like screens during meals, and focus on enjoying your food to support better digestion. Since stress can worsen stomach sensitivity, finding effective ways to manage stress is important. Techniques like deep breathing, meditation, yoga, or regular exercise can help calm your mind and reduce digestive symptoms. Building a routine that includes relaxation can make a noticeable difference in your stomach health. If your sensitive stomach symptoms persist for more than a few weeks, worsen over time, or interfere with your daily life, it's time to consult a healthcare provider. A doctor can help rule out serious conditions, recommend tests, and guide you toward effective treatment options tailored to your needs. To diagnose the cause of a sensitive stomach, your doctor may recommend tests such as blood work, stool analysis, breath tests, or imaging studies. These tests help identify infections, food intolerances, or underlying conditions. Accurate diagnosis is the first step toward effective treatment and long-term relief. Treatment for a sensitive stomach depends on the underlying cause. Options may include dietary changes, medications, stress management, or treating infections. Your doctor will work with you to develop a personalized plan that addresses your specific symptoms and lifestyle needs. Making small changes to your diet can have a big impact on stomach sensitivity. Try eliminating common triggers, such as dairy, gluten, or high-fat foods, and reintroduce them one at a time to see how your body reacts. Eating balanced meals with plenty of fruits, vegetables, and whole grains supports overall digestive health. Over-the-counter medications like antacids, anti-gas tablets, or antidiarrheal drugs can provide temporary relief for mild symptoms. However, these should not be used as a long-term solution without medical supervision. Always follow your doctor's advice when using medication for digestive issues. Beyond diet, lifestyle changes can make a significant difference. Regular exercise, adequate sleep, and stress reduction all contribute to a healthier digestive system. Avoid smoking and limit alcohol intake, as both can irritate the stomach and worsen symptoms. If your sensitive stomach is linked to a chronic condition like IBS or inflammatory bowel disease, ongoing management is key. This may involve regular checkups, medication, and working closely with your healthcare team to adjust your treatment plan as needed. Staying informed and proactive can help you maintain a better quality of life. Children can also experience sensitive stomachs, often due to food intolerances, infections, or stress. It's important to monitor their symptoms and consult a pediatrician if issues persist. Encourage healthy eating habits and provide reassurance to help them feel comfortable discussing their digestive health. As we age, our digestive systems can become more sensitive. Older adults may be more prone to medication side effects, slower digestion, or underlying health conditions. Regular checkups, a balanced diet, and staying active can help manage symptoms and maintain digestive health in later years. Pregnancy can bring about changes in digestion, leading to increased stomach sensitivity. Hormonal shifts, slower digestion, and dietary changes can all contribute to symptoms like nausea or heartburn. If you're pregnant and experiencing persistent digestive issues, talk to your healthcare provider for safe management strategies. Traveling can disrupt your usual eating and sleeping patterns, sometimes leading to a sensitive stomach. Changes in diet, water, and routine can all play a role. To minimize discomfort, try to stick to familiar foods, stay hydrated, and wash your hands frequently to avoid infections. Practicing good food safety is essential for preventing stomach upset. Wash fruits and vegetables, cook meats thoroughly, and avoid foods past their expiration date. When eating out, choose reputable establishments and be cautious with raw or undercooked foods to reduce your risk of foodborne illness. Reading food labels can help you avoid ingredients that trigger your sensitive stomach. Look for common allergens, artificial sweeteners, and high-fat or spicy ingredients. Being informed about what you're eating empowers you to make choices that support your digestive health. Regular physical activity supports healthy digestion by stimulating the muscles of your digestive tract. Even light exercise, like walking after meals, can help reduce bloating and discomfort. Find an activity you enjoy and make it a regular part of your routine for better stomach health. Getting enough sleep is important for overall health, including your digestive system. Poor sleep can increase stress and make your stomach more sensitive. Aim for 7 to 9 hours of quality sleep each night, and establish a relaxing bedtime routine to support your body's natural rhythms. Smoking can irritate the digestive tract and worsen symptoms of a sensitive stomach. If you smoke, consider seeking support to quit. Your digestive system, along with your overall health, will benefit from this positive change. Alcohol can be a trigger for sensitive stomachs, so it's best to consume it in moderation or avoid it if you notice symptoms. Choose lower alcohol options, drink slowly, and never drink on an empty stomach to minimize digestive upset. Everyone's digestive system is unique. Pay attention to how your body responds to different foods, activities, and stressors. By tuning into your body's signals, you can make choices that support your digestive comfort and overall well-being. There are many myths about sensitive stomachs, such as the idea that only certain foods cause problems or that it's always a sign of a serious illness. In reality, triggers vary widely, and most cases are not dangerous. Understanding the facts can help you manage your symptoms more effectively. To sum up, a sensitive stomach can have many causes, from food sensitivities and stress to underlying medical conditions. Most cases are manageable with lifestyle changes, but it's important to recognize when symptoms might signal something more serious. By staying informed and proactive, you can take control of your digestive health. If you're struggling with a sensitive stomach, remember that you're not alone. There are many resources available, including support groups, nutritionists, and healthcare providers who can help you find relief. Don't hesitate to reach out for guidance and support as you work toward better digestive health. Taking care of your digestive system is an important part of overall health. By understanding the causes of a sensitive stomach and knowing when to seek help, you can make informed decisions that support your well-being. Remember, small changes can make a big difference, and your health is worth the effort.